What the ACL is the anterior cruciate ligament is this ligament right here. This ligament between the femur and the tibia. It's in the center, and it tends to help stabilize your knee quite a bit. So that without an ACL is often injured in a twisting injury. Without ACL, the risk is you can tear a meniscus or both. There's a meniscus that's a cushion on both sides that acts as a cushion between the bones. The method usually of tearing ACL is foot planted in the ground and a twist like so. An external rotation of your lower leg and a valgus stress of your knee. The athletes especially those who play sports where you have a cleated shoe, or on a basketball court you have a lot of grip on your tennis shoes, and so your foot sticks and you turn. Now the football is a higher risk because while you're doing that, if somebody hits you on that same side, it's going to compel your knee into a valgus stress. So it's a twist and a valgus stress, and that's what puts it at risk. One of the classic is, in a young athlete, the classic story is, I came down hard, my foot was planted, somebody hit me, and I felt a pop. There is a higher risk in women. Most of the studies are in athletes, so they're in younger females. They've tried to prove that there is something to do with hormones. I think that may or may not be all that important. What's really important to me is that women are more likely to have a bit of a valgus thrust to their knee to start with, probably because the pelvis is a little wider, so your hips are a little farther apart than guys. So that puts your knees more like in a knock-knee position. That makes you more likely to land with a valgus stress. Our reconstructions, we usually are using something like a piece of patellar tendon. So we use a strip of patellar tendon, the central strip of about 10 millimeters with a bone block attached on either end. And that is nearly as strong. The other things that can be used are allograft tendons such as Achilles tendon or quadriceps tendon strips. So it's pretty strong. One thing we've found that you actually recover faster if you regain your motion before your operation. So we sometimes do prehab or preoperative rehabilitation. After ACL operation, we usually have you go into physical therapy virtually within a few days, and that therapy continues for 3 to 6 months. I usually have you on crutches and a hinged brace. The reason for crutches has to do with several things. One, your leg is weakened. It's actually been shown you can measurably measure the circumference of your thigh, and it's reduced in 10 days. So that's how quickly your quadriceps atrophies. So I think you're weaker, and I think it helps young athletes to remind them you can't go play pickup basketball.